I give up. I quit. I don't even care anymore. Just don't give a shit. Updated CDC guidelines now say people exposed to coronavirus may not need to be tested. Do tell. In a shift that perplexed some doctors, the U.S. Centers for Disease Control and Prevention has changed its COVID-19 testing guidelines to say some people without symptoms may not need to be tested, even if they've been in close contact with someone known to have the virus. Previously, the CDC said viral testing was appropriate for people with recent or suspected exposure, even if they were asymptomatic. Dr. Lena Wen, an emergency physician and public health professor at George Washington University, who was previously Baltimore's health commissioner, said on CNN's New Day on Wednesday that the testing guideline changes make no sense. These are exactly the people who should be tested, Wen said, giving the example of a person exposed at work who wants a test so they can protect their family at home. A senior federal health official close to the process tells CNN the sudden change in CDC COVID-19 testing guidance was a result of pressure from the Trump administration. When asked by CNN whether the CDC was responding to pressure from the White House and the Department of Health and Human Services, the senior official said it's coming from the top down. Here's what the CDC website said previously. Testing is recommended for all close contacts of persons with SARS-CoV-2 infection because of the potential for asymptomatic and pre-symptomatic transmission. It is important that contacts of individuals with SARS-CoV-2 infection be quickly identified and tested. So you guys can keep trying to blame Donald Trump all you like. The sickness is the sickness, the symptoms are the symptoms, the transmission is the transmission. Which is it? I'm over all this stupid shit, all this scary crap. Say what you want, think what you will. We've been exposed to a similar type of virus our entire frickin' lives. This is all bullshit. I'm over it. The CDC changed the site on Monday. Here's what it says now. If you have been in close contact within 6 feet of a person with COVID-19 infection for at least 15 minutes, but do not have symptoms, you do not necessarily need a test unless you are a vulnerable individual or your health care provider or state or local public health officials recommend you take one. Those who don't have COVID-19 symptoms and haven't been in close contact with someone with a known infection do not need a test, the updated guideline says. Not everyone needs to be tested, the agency's website says. If you do get tested, you should self-quarantine, isolate at home, pending test results, and following the advice of your healthcare provider or a public health professional. The CDC guidelines say if someone has symptoms and they're mild, a healthcare provider may advise a COVID-19 test. And if symptoms are severe, people should contact a healthcare provider and seek emergency care. It is important to realize that you can be infected and spread the virus but feel well and have no symptoms, the updated CDC site says, noting that local public health officials might request asymptomatic healthy people be tested depending on cases and spread in the area. In its pandemic planning scenarios, the CDC says its current best estimate is that 40% of infections are asymptomatic and 50% of transmissions occur before symptoms occur. Alrighty guys, there you go. The CDC doesn't know what they're doing. They got their head up their ass and they're still blaming it on Trump. I'm over it. Who cares? I just don't have any more wherewithal for it. Let's all pretend like our opinions matter. Leave them shits in the comments below. And remember, this is social media, so do all the things.